Thank you very much, Grace, for having me on KTN at 1. My name is George Gibore. I'm the General Secretary, Kenya Union of Clinical Officers.
Right. Now, tomorrow, Monday, we expect almost all healthcare cadres to be on strike. Doctors, nurses, clinical officers. Talk to us about how bad or terrible a situation will be in if this actually takes place, especially with the COVID-19 pandemic.
Grace, indeed, the situation is that the situation will be very bad, because you get to know that we have the COVID-19 in the country and there is other conditions. So when you look at the situation, how it will be, that you don't have any healthcare worker to address or rather to attend to any patient, then it will be very bad. And I think I need to put some meat into this, that we gave a strike notice beyond what is provided on the Labor Relations Act, which is 7 days. The clinical officer gave 14 days. This is after giving a demand letter 7 days prior. The government have not actually even had time to listen to us, not even having meeting to discuss on how to avert this looming strike. And now that's to mean that they have ignored our plea, they have ignored our issues, and we are trying to say that we are also dying because of COVID as healthcare workers, because of lack of PPEs. And when even we are getting infected and hospitalized, we are left to foot our own bills. And even I can give a good example of our colleague who died in Nandi, has left behind 2 million, which we are trying to raise as healthcare workers to foot. And no government element is there to support us. So we are feeling a lot of pain, and these are some of the issues that we are saying must be addressed, for if at all we have to avert the looming strike. But in any case, we want to say that for those who are seeking services in the public sector, must prepare on how they need to seek alternative place where they can be able to get the services.
Coming to us that nobody has reached out to you for a consensus during that period of the 14 days that you gave, right?
That's very true, that the Minister of Health, including the Council of Governors and all the counties, have not been able to have any meeting with us. We want to appreciate that indeed there was one meeting that we had with the CS Labor for CS Cherugei for Labor, where some of the leaders from the ministry attended, and also the COG, but we were not able to resolve anything, because it was just a 3-hour meeting. And that is why we are saying that over 11 issues that we provided, none of them have been addressed. I have seen in the media, they have said they have given orders that all the healthcare workers who have been infected will be catered under NHF on a comprehensive medical cover. If you reach out to NHF today, there is no plan that has been put in place, including we have active cases for clinical officers who are around 37. None of them, their NHF card has been accepted. So none of those issues have been addressed. So we will be going on strike.
Well, I think the phrase that says this is Kenya necessarily addresses everything that needs to be said. But the thing is, number one, so many people have been talking about doctors and how they're suffering because of the ongoing COVID-19 pandemic. And people have been saying that not enough has been done to help our doctors, and at the same time not enough has been done. Like, you know, it's a whole new experience, it's a whole unknown. It's like something no other government in the world has experienced before. So people are really trying to make things up as they go along, pardon the phrase. But here's the thing that irks me. As I said, the national debate has been around, nobody can stop reggae and nobody can do anything, and doctors are dying. Whether you gave your opinion on whatever is going to be done on BBI or whatever, and people are dying. The numbers are still going up. Political rallies and meetings are being held by politicians, and the number of COVID cases keeps on going up on the rise, not only here in Kenya but across the world. I mean, people are tired, people are dying, people, like, so much is going on that, and it's so painful to see that the national conversation is about Building Bridges initiative, which, to give it applause, is important. We have that discussion, but is it really a priority? Because now look at this: if national, if healthcare workers go on strike, right? What's going to happen to the COVID-19 patients? What's going to happen to testing? What's going to happen to if you go to just a hospital with any other ailment, you'll be forced to go to a private hospital where the bills are expensive, and at the same time it's difficult for just any ordinary Mwananchi to get access to the healthcare, private healthcare system, unless you are adequately insured by any insurance scheme in the country. And the thing is, if a strike notice was given with ample time, as inside, the conversation should have been held almost promptly, because this issue is very pertinent. It's very important, and it's very time pressing. Yeah. And here's the thing. I mean, it's just sad that as a nation we can just sit and watch this happen and not have words for the leadership, especially political leadership. And this is not only for people in government and people in opposition, just for everybody. A common sense of decency, because these are the people risking their lives to ensure that we are okay. What do we tell families of doctors? I do have relatives who are doctors who are face to face with some of these issues, and you fear for them, but at the same time you're like, if I fear for them, why isn't the people who are supposed to take care of them taking care of them, taking their job seriously? So I think that a lot needs to be done, and I think that it's not about doing it yesterday or doing it today. It's that you do it as fast as possible, and don't give promises that you can't keep, because take care of our doctors, then take care of the nation, because healthcare is a primary function. And if a country's healthcare system breaks down, then the country loses millions, because healthcare is a very important aspect even when it comes to economics. So it is important that people who are responsible for our healthcare workers take their job seriously and protect our workers.